So good morning, everyone. I am so pleased that this morning we have John Mason from BrightStar of San Fernando Valley with us. And we're talking about things you should know now as we're going through the coronavirus pandemic. I really don't even like using that word, but it is what it is. And so, John, good morning to you. Thank you so much for joining us this morning. As you know, living with Parkinson's isn't always easy, and we now have the coronavirus to add to the complications of Parkinson's. So we have a few questions we're going to ask you this morning about people who are dealing with in-home care agencies, because the concern is out there. There are people who are turning their caregivers away at the door because they're afraid to let them in. There are people who need to hire a caregiver, don't know where to go, how to get started, and particularly now. So let's address a few of these. And so the first thing is, you want to tell us a little bit about BrightStar Agency?
Sure. Yeah, Joe, as we've spoken many times, but we're a home care agency. So we provide care for seniors in the home with Parkinson's, dementia, many disease states, and we're all licensed and bonded. And one thing we do that's particularly important now is I have a director of nursing. So she supervises care, and she's supervising this coronavirus outbreak and managing it using just important infection control measures. So I think it's really important, especially now, to have a nurse supervising.
Well, and so to that end, I've talked to several agencies trying to figure out what's the best information we can get out to the public right now, because it's going to be short and sweet. But what are some of the methods that you and your director have employed? First, I suppose, with the caregivers, and then what are you doing to protect the client, the person hiring the caregiver? So there's two questions there. Let's start first. What are you doing to educate or protect your caregivers?
Well, the first step is education. So we have a coronavirus module that we sent to them, so they read that and take the quiz and send it back, and that's mandatory. And it's basically explaining what it is, how infection spreads, and then the importance of infection control. And then my nurse has called each one individually to discuss infection control. Wash your hands, be cautious. And our BrightStar is a franchise, so we have this, people have to log in on their phones. And so now, before they log into their shift, they have to take a little quiz that says, are you coughing? Do you have a fever? Body aches? And if any of those yes, then we get an alert right away and we take them off the shift. So we're taking it very seriously. We want to be safe. We're treating an at-risk population, and we cannot slip up here and take it lightly and send someone in that's sick.
And I will say to you, you're one of our wellness villagers, and the reason that we have you in the wellness village is that we know that our people can depend on you. That's what we've really worked very hard to do, is vet the people in our wellness village so that people know when they go there, they can actually depend that they're getting real quality people. So thank you for that. Now, have you created a kit for the caregivers? Do they have gloves or things like that?
Yeah, we have gloves, and these are hard to get, but those N95 masks we have ordered, so I should get those early next week. So I have enough for all of my caregivers, and so they will have those just as a precautionary measure. We also have what we call PPE kits. It's a personal protective equipment, and in that is gloves, a gown, and a face mask. But the N95 is a level up. It's a little more more expensive, more effective mask for this viral spread.
Terrific. Okay. And so for those clients who are turning the caregiver away at the door because they're afraid to let them in, what are you telling them? What should we tell the world about that? I guess where I'm really headed, John, is not all agencies are as really good and careful and protective as you are.
Mm-hmm.
So what should a client know about coming to an in-home care agency today under coronavirus?
That, as I mentioned earlier, just the clinical supervision, what is the agency doing to protect, and for us, since we have a nurse, I think that's one of the best tools to control this infection outbreak. So if they are, they don't have clinical supervision, which many don't. It's just the marketing person or the director. that I would be have some concern, have a little pause there, because this is very serious and we're an at-risk population. So you do not want someone that's just kind of winging it or not sure what they're doing, just reading stuff on Google, to be in charge of your loved one's care.
We're trying to get as much information out as we can. And so for those people who are listening, this is a Joe Rosen thing. When someone with Parkinson's gets an infection, whether it be the flu, a cold, an ingrown toenail infected even, it compromises their position. You may find them lethargic. You may find them just confused, not knowing where they are, etc. So pay attention to viruses and infections. And if that's happening with or to the person with Parkinson's, call the doctor, see what it is that can be reversed if possible, and to get them back on track as quickly as possible. The biggest thing right now is probably going to be urinary tract infections because of isolation, where there's just not a lot of moving going on. So keep your person with Parkinson's moving. Keep away from infections of any kind, colds, flu, viruses. We're going to do our part at Parkinson's Resource Organization, as John is doing his part at BrightStar San Fernando Valley, to make sure that you're as protected as possible and that you have as much information as you need. I've got my sunshine today, everybody. This is my sunshine for the day, to make you happy, bright, and to tell you to have a good one. John, anything you want to add?
No, just to follow the recommendations, the social distancing, think about just controlling infections. So you don't need to go. If you don't need to go somewhere, it's better to stay home.
Yeah, so appreciate you. Thank you so much.
All right. Thank you, Joe.
Talk to you soon.